So, power of a healthy lifestyle, something that is easy to say, even harder to do, something we all, work on as best we can. Whether you're a clinician, a patient, a family member, anybody, this is something that's important to all of us to treat our bodies right. So, and it's very important for many, many medical conditions and just being a person in general. So, going through here. Just to let you know that I don't have any other financial relationships to disclose other than being an employee of Capital Health. And afterwards, if you'd like to come see me at the Capital Health Washington Crossing location, that's where I am, right next to the veterinarian's office, next to Dominic's Pizzeria. All right. So learning objectives, talk about why it matters. We all know that exercise and a proper diet is important, but giving some information to help strengthen that point. Also, what sort of things clinicians are looking at when it comes to effectively discussing lifestyle modifications, and you can use that for yourself. You don't necessarily need a clinician to tell you that it's important, but these are some points that you can think of yourself when thinking why you should get this going, and then how to do goal setting, track therapy. And I do want to throw out there that I do discuss towards the end some medications and surgical options, but that's just to recognize that they do have a role in weight loss when appropriate. It's a brief segment. It's not necessarily endorsing them, just to show you when they do have a role in healthcare. So this picture, just to give you some background, one of my bigger influences when it comes to health is my grandfather. He wasn't a big fan of physicians because he felt that if you ate right and exercised, that you could take care of yourself. And in many ways, I agree and disagree with him. And the reason why I use this photo, he was big into doing handstands, was doing handstands up until I think it was his 70th or 80th birthday. 70th, not 80th. So just the idea that, he was right for many conditions, but there are places where, medications certainly have their role. So why does it matter? Even as recently as 2014, Boris Lushniak, the acting U.S. Surgeon General, talking about how physical inactivity is the major public health issue in this country. Point blank, it's something that is been made that much more difficult by our busy lives and our screens and all that, but it's something that we still need to focus on in this day and age. When it comes to leading global risks for mortality in the world, you have high blood pressure, you got tobacco use, you got high blood sugar, glucose, and then you have inactivity, overweight and obesity, kind of fallen in together, which is why the World Health Organization, as well as many health organizations, have tried to come up with initiatives to combat this. Things like the Get Your 150 initiative, the U.S. Preventative Services Task Force, the USPSTF, saying that we should be shooting for a goal of 150 minutes per week of exercise. So about 2.5 hours. Which is doable, but it does take work. Or for Children, the Play 60 initiative by the NFL, but there are plenty more organizations outside of the Football League that have their take on exercise. The estimated number of deaths attributable to obesity in the United States ranges from 100,000 to 400,000 per year. So that makes it a very important cause of preventable death. If you look at BMI levels, BMI, a quick height to weight ratio, if you look up BMI calculator in your whatever search engine you use, easy to find it. A normal range is 20 to 25. For Young men and women at very high BMI levels, so 45 and up, unfortunately, they can expect to die 5 to 20 years earlier than their non-obese counterparts when matched for race and gender. So it's an important characteristic in our health. Physical activity and fitness have been shown to reduce morbidity and mortality in all individuals, regardless of weight. Even for people who fall in that 20 to 25 BMI category, physical activity and fitness is still known to reduce morbidity and mortality over. All right, just making sure. Now, in this slide, you can see that when it comes to overall contributors to a person's health, a large part is exercise, smoking, and diet. Decisions that a person makes on their own free time, not in a doctor's office and not by a doctor. It's themselves. Yes, access to medical care is important, and the environment that you grow up in and your genetics do play a role. But as you see, half of it is roughly your own health behavior. And when you want to talk about level of evidence for how a health
Dr. Murphy, I think we may have lost your audio. Let's see. Lost audio. Let's see, I'm going to try to. Dr. Murphy?
difficult things in this day and age, and even more so during this pandemic, but activity can help combat those. It's not always the full answer, but can certainly help. And then you have moderate to strong evidence for it helping to lead to better functional health for older adults and reduced abdominal obesity. I mentioned the BMI earlier, but that isn't the full picture. BMI is very a quick.
Dr. Murphy, for some reason, we keep losing your audio. I don't know if you can hear me. Dr. Murphy?
And exercise in itself is a very good tell of the likelihood of keeping weight off after you lose it. It's decreasing the calories that helps lose the weight, but the long-term keeping the weight off is very well predicted by if somebody is physically active while they're doing it. And then you see other things that you very well are probably aware of, things like bone density. Think of osteoporosis, thinning of bones, and how if you do more weight-bearing exercise, it helps increase bone health as well, and better sleep quality, decreased risk of hip fractures because it helps decrease the risk of falls. So all these sorts of things. So you can see that it helps in many ways. Now, this is quite the busy slide, but this is to help identify how it actually decreases the risk of cancer. So you see the red circles I got here, and the main point I would like to make out is this: you can reason how inactivity, obesity increases the risk of cancers. You notice points such as numerous inflammatory factors, interleukins, increased bioavailable estrogen, hyperglycemia or high blood sugar, high insulin levels the body tries to do to get rid of the glucose, the sugar, and they can all be tracked to increasing the growth of tumors. And that has led, again, to these initiatives like this, where exercise is medicine. Yeah, it can be underutilized because it's difficult to make happen. It's easier to say take a pill once a day, but really exercise, when done right, can can really do the job of a good number of medications. It's not necessarily the easiest thing to do, but it can be done. So you see the ones here. And when it comes to high or medium intensity exercise, that leads to these benefits that you see. That's increased overall fitness level, improved HDL, the so-called good cholesterol, better insulin sensitivity, so you have less sugar floating around, so you have less insulin need, leading to that decreased risk of cancers. You have better cardiac function, heart function, and more enjoyment of exercise and a better quality of life. It's not only about number of years, but also quality of years. And that's a goal of all of medicine, is to try to improve the quality, not just the quantity. Then when it comes to medium versus high intensity exercise, what does that really mean? There are ways you can help calculate that, and it's really in referencing your heart rate. You can do 212 minus your age, and that gives a rough estimate of your maximum heart rate, and then you can take 70% of that. 70% up is in line with high intensity exercise, generally speaking. But if you'd rather leave the numbers aside, you can do a rather simple thing called a sing-talk test. So if you imagine that you're working out really hard, you're breathing hard, it's hard to talk to somebody or to sing along with a song or something. So a good way to tell if you're doing high intensity exercise, if you're working so hard that you aren't able to sing along with a song that you have going on in your headphones, and you aren't able to hold conversations with the person you might be running with. While moderate intensity exercise, you are able to talk to somebody if in short sentences, but you aren't able to sing along with the song that you got going on in your ears. So that's how you can give a rough estimate of your moderate versus high intensity training. And that's what I'm referencing it when everything is relative. For one person, high intensity may not be the same for one person versus another. And there are risks to exercise, just like everything in medicine. We hear about risks with vaccines and medications and procedures and surgeries. Well, there are risks to exercise too. Everything comes with risk. It's always weighing the benefits versus the risks. And in this case, even in young individuals, there's a risk of sudden cardiac death or sudden heart-related death in 25 to 35-year-olds. This Kings County study showed an incidence of 4.4 deaths out of 100,000 people, generally related to coronary artery disease, what you relate to heart attacks. And then it breaks down the other heart-related causes there that can be related. That being said, the overall risk of death from exercise is relatively low compared to the risks from many other activities in life. The other side effects, yes, you could get injured. And then this is a, little cheeky one, but you can also sweat. You can improve your blood pressure. You can decrease your pulse. You can decrease your blood sugar, improve confidence, improve concentration, better sleep, better bowel health, better bowel movements. You look and feel better. Granted, again, that's also a relative thing. And stronger muscles and bones. And, so those are side effects that I like. But how do you counsel somebody on it? How do you even convince yourself to get up and go? So it can take time to discuss it with somebody. It can be, people can be skeptical. Oh, well, we're going to die of something. Not really seeing the utility in having that improved quality of life that lots of evidence points to with improved lifestyle choices. And also access to resources. Not everybody is able to speak with a dietitian or do a whole course that's done at like a local gym or something like that. Those things help take down those barriers. And 4 cornerstones of physiologic health here. You got your cardiorespiratory fitness, your metabolic fitness, muscular strength, and body composition. And we'll go through those a little bit more here. So cardiorespiratory fitness, really that's an idea, you get an idea of that with the maximal rate of oxygen consumption, your VO2 max. So the more oxygen your body can use, the more fit your muscles are, generally speaking. Then you have metabolic fitness, either muscle mitochondrial oxidative capacity or lactate threshold, muscular strength, how much are you benching? I say that somewhat sarcastically. Body composition, going back to what I was talking about earlier when it comes to quality rather than quantity of muscle. As you see in the picture here, you have a BMI that's roughly equal in these 2 individuals. But that doesn't give the full picture, as you can see. So although BMI is still a helpful tool, it's good to look at, well, how much is fat versus muscle mass? How much adipose or fat tissue is related to viscera or body organs, as well as how dense are your bones. That leads to more weight. So don't let the practicalness of calculating BMI mislead you. And actually, just to jump back really quick, I do want to throw out there that when it comes to those risks of exercise, as I was talking about with young people, which is also true as we age too, that risk doesn't go away after 35 years old. Really exercise stress testing. So when you're thinking, okay, well, now I'm nervous if I have a problem with my heart. Should I get tested before I start an exercise regimen? Exercise stress testing is not required to start a physical activity program unless it's indicated by symptoms that are concerning for possible heart disease. Like, I frequently develop palpitations, my heart races, skips beats when I try to be active, or I have a shortness of breath that's out of proportion to what I'm doing, or I'm developing chest pains. Those are all things I would say, okay, well, maybe exercise isn't the best thing to do right now. In the future, very likely. But, I want to look further into the cause of those symptoms first. So the American Heart Association does recommend screening all patients with a history of cardiovascular disease or who are at high risk for a heart attack or stroke before they start a vigorous exercise program. Just give you an idea of when further testing is warranted before you even start a significant exercise jump. Now, here I am contradicting myself talking about BMI so much. These are BMI related numbers. But this is what your physician, your clinician is generally looking at because of how practical it is to look at quickly. So obesity, BMI of 30 and over, and comes into different classes, pretty much every 5 points. And then when it comes to overall risk of disease related to obesity as you go up those stages, so overweight, that BMI of 25 to 29.9, you're at increased disease risk, but you're at pretty much what you're seeing here is with every single jump in your class of obesity or being overweight, it increases your risk of disease that much more, which goes in line with the evidence that I was discussing earlier that can lead to premature death, unfortunately. How can you tell your body composition if you don't want to use BMI? If you want to know, okay, well, how much weight do I have in fat versus muscle? There are multiple ways to do it. You have these body pods, hydrostatic weights, skin fold calipers, bioimpedance, and these are some ways that you can tell. So these are pictures of them. In the top left here, we have the calipers to help get a measurement of your percent body fat. You got the hydrostatic weighing. I have yet to see that one done. As you imagine from the picture, it's a little bit more difficult than just, let's say, using the bioimpedance machine to the right where you just hold either handle there. The hydrostatic weighing, more so for high-level athletics and such. Then you have a DEXA scan in the bottom left, looking at the bone health. And then you have the bod pod in the bottom right there, even fancier still. And don't think that losing composition is a foregone conclusion with aging. You see here in the top, you have a 40-year-old triathlete. That darker gray bit right here is all muscle. You have bone right here in the middle, and you have the skin out here. Then you go down to the 74-year-old sedentary man, and all this is fat around your quadriceps. So these are the legs in a CAT scan. And then you have muscle here. You see that they're a bit more, quite frankly, shriveled up. You even have some fat deposition in the muscle itself. Yet here's a 70-year-old triathlete. Does that look any different from the 40-year-old triathlete? So you can maintain that sort of health with good lifestyle choices. Then a little cheeky cartoon here. Yes, what fits your schedule better, exercising 1 hour a day or being dead 24 hours a day. A bit harsh, but you get the point there. When it comes to the stages of behavior change, and this not only applies to eating better or exercising, but also to things like quitting smoking or anything that requires change. You have your pre-contemplative stage, where you may need to hear about the possible consequences of your behavior. Some need just a supportive atmosphere to start feeling better heard and just consider it further. Then you have your contemplative stage, where you may need help going over the pros and cons. And when going over pros and cons, it's pros and cons for that person or yourself. You got to figure out which reasons are the most important to you. You can talk about all the medical reasons until you're black and blue in the face, but if that's not the thing that means as much to you as, let's say, if you were going to stop smoking and you wanted to not smoke a $10 pack of cigarettes and have that eat away at your bank account, that could be the most important reason for you. So it's recognizing which pros and cons are the most important to you. Then you have the preparation stage, where you may need some help coming up with a plan. Then you have action, actually going for it, and then maintenance or relapse. Rinse and repeat. So if you are trying to not possibly coach yourself up or coach somebody else up, motivational interviewing is the better way to do it. It's not just lecturing, quite frankly, like this. This gives some information, but this isn't the way that I would talk to a patient in the office about weight loss. Yes, it's helpful to give that sort of information, but you want to be a much better back and forth. Just talking to somebody or sometimes feeling like at somebody is not the best way. Because normally when it comes to why the change hasn't happened yet, it's not because of laziness or denial or oppositional personality where they just want to fight me. No, normally it has some level of ambivalence or mixed feelings or contradictory ideas about something that they're thinking about doing. This ambivalence leads to procrastination because ambivalence is a stressful situation. So with ambivalence comes anxiety. We don't like anxiety, so we procrastinate. Sorry about that loud bang there. Drop something on the floor. That's often mistaken for resistance, the procrastination, but it's not. It's the ambivalence that's leading the charge there. So the motivational interviewing really helps to resolve some of that ambivalence and elicit a person's own motivation to change. Important themes with it include partnership, avoiding being acting like the expert, recognizing that, we all have our shortcomings and failures. We all have things that go on in the background. We all are trying to get by. We all have to, have to put our pants on one leg at a time. That sort of bit. Also, respect a patient's or a person's autonomy, their strength, their perspective with all this. They've been living with their body longer than you've been talking about it. Also, compassion, keeping a person's best interest in mind. If you're looking to make a change, you're keeping in mind the bigger picture. It's not just, okay, well, I have to work out 24 hours a day. That's not feasible. So that's not keeping your own or somebody else's best interest in mind. And then evocation there, best ideas can come from the other person too. Just because you're talking about it doesn't mean that you might have some better ideas to help you make a change than perhaps I do. So it's really working in that partner role here. You want to establish a trusting, mutually respectful relationship, going back to being partners, not, the expert and the student. That's not the way to do it. You want to focus a process of seeking and maintaining direction. You want to set specific, measurable, achievable, realistic goals and priorities. And that's what I'm referencing with the SMART plan there. Specific, measurable, achievable, realistic, and timed. These points help keep you on the path moving forward. You don't want it to be too vague. Oh, I'm going to eat healthier over the next 10 to 30 years and exercise a lot. How do you know if you've actually met that goal or not? You don't. It's too vague. So that's why you want to be more specific, measurable, achievable, realistic, timed. And then ways to attack physical inactivity to actually get our butts going. It's things that help keep you honest. You have things like your diaries, you have pedometers, you have frequent follow-up, and it doesn't have to be in a doctor's office. It can be with yourself. It can be with others. Knowing that you're going to talk to a friend, a loved one, a workout partner about where you are in an honest way. And then when it comes to the diaries, really that's any method of self-monitoring. You have, food diaries, you have, and this isn't an endorsement for it. You have your smart watches, you have anything that can keep account of what you do, or just what you picture when you say the word diary. It can be a book that you write in. It can be anything that you use to track yourself. So things like recording the weight you're lifting, tracking your intake of calories, exercise, being a vital sign is an interesting point. Exercise vital sign in the hospital. As studies have shown, hospital patients who walk during a hospital stay have fewer complications and get discharged sooner. Now, obviously, that's not feasible for all patients if you're not healthy enough, but it does lead to the point where if you can walk, it's important in the hospital even to get up and walk. There have also been several studies that have suggested that more frequent weighing, perhaps daily weights, may result in better weight loss and maintenance over time because it keeps you honest. It gives you a specific measurable item. It's essentially becomes a form of a diary. In regards to exercise schemes, I commonly find that the exercise that is going to be best is one that you enjoy. Which exercise is best, I think, is a relative thing. For some, they like running. For myself, I love playing basketball. I can get distracted by the fact that I'm chasing a ball around. Fine. With how much I enjoy it, you'd think I'd be better at it, but it doesn't matter. That's not the point of it. It's really just to get your heart rate up, get some exercise in. Now, there are some pros and cons to each activity. And there are even books about that, like this FYSS book, as pictured to the right here. It gives activity indications, mode of action, what sort of dosage you'd be looking at doing, time, intensity when it comes to dosage, and what sort of side effects, contraindications you'd even be thinking of when it comes to certain activities. And then there are these ways of prescribing exercise that many organizations have been pushing clinicians to use, but really, you don't necessarily need this. These are just supposed to be motivational and to push the idea that exercise is, in its own way, a medication. Eating the right foods is also, in its own way, a medication. So, multiple weight loss schemes have been proposed over time, and all have their pros and cons. So like we were saying, you see number 4 on this list, exercise. Exercise, how does it do for weight loss? Not great by itself. Really good when combined with the right diet. It's a great indicator of keeping weight off after you lose it. It's still a great idea to do with the proper diet. But there are other things you can consider, like surgery, medications, group weight loss. That way it also helps keep you honest. Meal planning, a great thing to do. Time management, fine. Stimulus control. If you can't trust yourself with Doritos in the house, don't buy them often. Once in a blue moon, you can get them, but don't keep them in the house if you can't trust yourself not to go through the whole bag in a night. That doesn't come from a personal place there, I swear. Then we have different weight loss schemes, plans. You have things like the Atkins diet, low GI diet, the Mediterranean diet, this Ornish diet, South Beach zone diet, and all of them have their general what they're trying to do there. Whether it's Atkins, really a whole lot more protein. Mediterranean, where it's more so a balanced decrease in calories, where you're eating more fruits, veggies, lean proteins, plant-based fats. Then you have the lower fat protein approach, zone diet, which is more of a balanced approach. So multiple different diets you can consider, but really whichever diet scheme works for you is going to be best. When it comes to which one is best, studies have generally shown that they all are about equal. None have shown themselves to be significantly better than another. They all can lead to weight loss. Generally, a lower carb diet leads to more weight loss quickly, but they all are roughly equal. So it's finding the one that works for you. And there's also, a thought of what is the right rate to lose weight. A reasonable goal for weight reduction in a person who has a BMI of 27 to 35, so kind of those upper stages of the overweight category to class 1 obesity category, is to lose about a half to 1 pound per week. You shouldn't be losing 20 pounds in 1 week. That's not healthy, because then you start losing muscle mass and good muscle mass. I'm not necessarily talking about just muscle for the sake of vanity, but it's important for your body to have muscle for balance for many reasons other than just looks. When you are at higher weights, the class 2, 3 obesity, the 35 plus BMIs, you can lose closer to 1 to 2 pounds per week. And that is relative, because you're going to lose more weight at first because of water weight. Fine. But still highlights the point that you should not be losing a lot of weight very quickly unless you are being monitored. Pretty much all of these diets, they focus on cutting calories. In some way, shape, or form, they cut calories, and that is the one thing that has been shown consistently to lead to weight loss, is cutting calories. And very low calorie diets can result in greater short-term weight loss, but substantial weight regain is common. And guidelines generally advise against these approaches unless highly supervised. And a very low calorie diet is less than 800 calories a day. So that's pretty darn low. All right. So I think we can move off of this. And just the idea of what sort of things you're looking at. Lifestyle modifications is the main thing we've been talking about here. But when do medications, when do surgery play a role? And this is the general guideline that I use. Granted, other clinicians may have their own opinions when it comes to the appropriateness of medication surgery. But this is generally the what I believe is a proper way to attack it. So as you see, there are times that you could even consider medications if you have comorbidities, other medical conditions, medical concerns, whether it be diabetes, hypertension, heart disease, other things that make that extra weight carry that much more weight. And you see that surgery isn't even considered until you're at class 2 obesity and up. And that's with comorbidities at your class 2 obesity. Class 3, you consider surgery if you've tried everything else. And, it's difficult, but surgery is there's a lot of risks that can come with that. So you really want to try to exhaust all other options before you go under the knife. When it comes to medications, lots of different options, but no matter which agent is used, weight is often regained after cessation or stopping the medication. So you see that there's a lot of possible side effects with a lot of these medications. Because it's making a big promise when it comes to losing, on average, compared to placebo, anywhere from 2.5 to 4.5 or 8.9 kilograms, closer to 20 pounds over a year. Yet the likelihood is more often than not, the weight is regained after you stop the medication. So why does it have a place in proper practice of medicine? Because sometimes it can be really motivating to somebody to just see the weight come off, just because the likelihood that the weight comes back is going to come back. It's not a guarantee. These are just likelihoods, odds. But for some people, it really helps jumpstart their weight loss. And then there are other medications that are used for less than a year, such as 3-month prescriptions of things like phentermine, diethylpropion, these medications that you see listed here. And if you do exhaust all of these things and you are thinking about items like bariatric surgery, you really want to consider the possible long-term side effects, such as possible need for reoperation, gallbladder disease, difficulties with proper absorption of vitamins and minerals that the body needs. But in general, when it is indicated, it can have marked improvement in many related comorbidities. For people who get bariatric surgery, a very high percentage of people end up having resolution of type 2 diabetes, hypertension, sleep apnea, a lot of things that carry a lot of risks themselves. So that does have a role and can be very beneficial for a number of people. We've all heard or known or possibly even been somebody who has seen either the big help that bariatric surgeries can lead for people. So with that, I give you my bibliography, just going over where I got my resources here. And I want to thank you so much for listening to me. It's been very nice having this time with you. These are just some photos of me and my buddy Chuck going up Mount Tanzania back a few years ago. Great time. And yeah, that's what I got. Thank you so much.
Hello, everybody. I just wanted to remind you if you could kindly fill out that evaluation form. I sent the link in the chat box before you leave tonight. It's really helpful for us to get feedback, and also if you have any program suggestions, we like to have those as well. I want to thank Dr. Murphy very much. So we're going to do some Q&A. So you could fill out the survey and maybe take turns asking questions. I'll read the questions that are in the chat box that we have, and then Dr. Murphy, if you could answer, that would be great.
Should I stop sharing the screen at this point?
Yeah, you can stop sharing. Okay, so there, good. I got to get my face back in here. Questions. All right, just going down. So the evaluation link is there. This is the first question. I often fall asleep while watching the evening news after dinner, and then I wake up at about bedtime, but then do not fall asleep once I am in bed because I am not then tired. Any suggestions on how to resolve this common problem as we get older?
That is a tough one. The quality of sleep, to a certain extent, does degrade over time. And I wish I had a way to completely take that away, but I can't. It is important to look for other conditions that can affect the quality of your sleep when you are supposed to be sleeping. If you are worried about, like, could it be sleep apnea? Could it be something like where I am sleeping during the daytime because I'm sitting in a recliner, but once I lie down in bed, I don't sleep as well, because that's when sleep apnea is going to be more difficult. Not saying that you have it. I'm certainly not diagnosing it, but just giving you some scenarios as to perhaps there's a reason why sleeping during the day is easier. And then there are other general sleep health considerations to make, such as making sure that you have a regular wake up time. So you wake up at 6 a.m., set it at 6 a.m. every day, and you won't have to worry so much about getting to bed at a certain time, because you'll be tired by the time, if you keep on going to bed at 1 or 2 a.m. And really trying to work on not sleeping during the day when you're setting that regular daytime or wake up time. But how to keep yourself from falling asleep during the day, that is a tough one. It would be also good to speak with your physician, your primary care doctor, or healthcare provider, to make sure that there isn't a medical explanation for why you're falling asleep during the day too.
Thank you very much. And then the next question is, do we have anyone in our behavioral health department at the hospital that works with patients trying to lose weight on their own without surgery? Basically, being overweight, a lot of us have a food addiction. I'm a Capitol Health employee that has been trying for months to find this out, and someone was supposed to call me back as they said they didn't think there was anyone. I'm going to put my email address in the chat box, and you can email me. I work constantly with the behavioral health department to set up programs. They're in big demand right now. So I will do that, and you can always write me. Again, it's Marcia Rudolph, and I'm in the community health education department. I'm actually on the hospital mail system, so it's mrudolph@capitalhealth.org. But I'll just put that in the box. So yes, Dr. Murphy, any thoughts on that?
So I've been using more so like our dietitians when it comes to helping counseling in regards to those food choices we make. Certainly having perhaps cognitive behavioral therapy can be helpful as well, because it is very common to have, or more common than we may even recognize, to have food addictions per se, to keep on making the wrong choices when you know what the right one is, but it's much easier said than done sometimes. But keep on, seeking the help. And I certainly appreciate the fact that, you're listening to lectures like this and trying to do everything you can to give yourself a helping hand here.
I'm just typing thank you very much. My email in the box. Anyone has any other questions? We have one other question. Is it really possible to lose fat around your organs?
Yes. More often that comes with losing general body fat itself. So it's normally not as much as we may see around our bellies and what have you, that central obesity. But it is possible to lose fat around your organs, yeah.
Okay, anybody else? If you have a question and you can't figure out the chat box, you could unmute for a moment and just ask. So I'll give you an opportunity to do that. And then otherwise, if you can also, I'm going to stay around for a while. If you can fill out the survey, that would be great, which again is in the chat box. So thank you very much, Dr. Murphy. Is there anything else you would like to say before we end this evening?
Just looking at the Zoom group chat there, I apologize for losing audio. It looks like I lost audio a few times there. I really apologize for that.
We're in the beginning. Yeah.
Okay. All right.
The recording. Oh, here's a question. Sadly, I missed the beginning of the program, and I see it's being recorded. Are you emailing the recording after tonight? So it has to go through our PR team. They check it out, make sure everything is okay before it gets posted. And then they will send me the link. So if you're interested in getting it, it might be, a week or so. But again, I put my email address in the chat box, so you can email me if you don't hear from me, maybe within a week. That would be great. Where is Dr. Murphy located? Town.
Washington Crossing. So just in case this was part of the audio that cut out at the beginning, the Washington Crossing Primary Care Office, it's not labeled as well as some of the other offices. So we are next to the veterinarian's office, but I guarantee you we see people. We are under their sign, but we are in between them and the Dominic's Pizzeria at Washington Crossing, perhaps 3 blocks from the Little Bridge.
Okay, let me just see if there's anything else. I don't think so. Lots of thank yous. So thank you. Oh, wait, here's one. I recently was diagnosed with 2 meniscus tears, which had, it's then cut off. I was recently diagnosed with 2 meniscus tears, which had, that's as much as I have right now. And then there's an S. So for some reason, it didn't come fully through. Anthony, if you want to unmute yourself, then you could ask that question since it looks like it was cut off. See if I can find you, Anthony.
Yes.
Okay. There.
Hello.
Yes.
I was well, I started to write the message and it got cut off, but I was recently diagnosed with 2 tears in my meniscus. And as a result, it's greatly affected my my exercise. I'm hesitant to go into, even do surgery at this point. But do you have any suggestions as to what can be done?
Sure. So meniscal tears. We can have our own perceptions and even sometimes misunderstandings about them. We tend to think of, especially in the sports medicine world, like, must have been torn while playing football or something. But they also can be quite common with wear and tear arthritis, in which case that completely changes what the management is. So one important question is, what is the cause of the meniscal tear? If it is more of a wear and tear arthritic cause for the meniscal tear, oftentimes more conservative management using a lot of times physical therapy to strengthen all the muscles around the knee can really help the knee adjust in its own way to having the tear, not even necessarily requiring the surgery, to the point where you're able to do exercise on your own after you're cleared by physical therapy, and having a solid regimen to do at home, even to keep the knee as healthy as possible. So you could do that for both knees, or whether possibly both meniscal tears in the same knee or in both knees. I forget that.
Both in the same knee. I had did have a CT and I had an MRI,
Mm-hmm.
and it was I had minimal arthrosclerosis or whatever.
Yeah, the arthritic changes.
Yeah, so, and it came back minimal, and other than that,
yeah, oftentimes if it is a more traumatic tear, not from wear and tear arthritis breaking it down, then the advice recommendations of an orthopedist really becomes that much more important, because their expertise about delineating just how helpful the surgery may be, because you're often looking down that route a bit more. And I'm not guaranteeing that. I don't know enough about your knees just yet from that, but it does make the likelihood of surgery being helpful that much more likely.
Okay, thank you.
Sure.
Sorry about that. I was still muted. So if there aren't any other questions, again, I'm going to stay around for a little bit. If you want to linger and fill the evaluation, again, we would really appreciate that. And I want to thank Dr. Murphy tonight. We appreciate your time and being a new dad and taking the time out to speak to us. We
Oh, it's been my
appreciate it.
pleasure. Thank you again, everybody.